So hello everybody. Today further discussing about AI role in future professions, and we have our guest Emma, and who's going to tell you more about AI and its impact on our lives. I'm the host Makara, and continue listening if you would like to learn more about this topic. So how are you, Emma?
Hi, Avocado. I'm great. What about you?
I'm also good. I'm glad to see you there.
I'm glad to see you too.
So, the main question we are going to address today is advantages and disadvantages of AI in the medicine field.
So, a lot of people might not know what AI actually means. So, AI is artificial intelligence exhibited by machines, particularly computer systems. So, in broader terms, that would be robots and so forth. These robots' intelligence resembles a human mind.
Seated at the console, the Da Vinci surgeon views a remarkably clear 3D image of the surgical field. The system scales, filters, and translates the movements of the surgeon's hands on the master controllers to 4 interactive robotic arms on the patient cart.
Do you agree that AI has a huge impact on our lives and made them significantly easier?
AI has truly made a massive positive effect on our everyday lives, such as smartphones, shopping, specifically the medical field we're going to be addressing today.
On the other hand, AI might pose some more threats in mentioned medical field. Therefore, we are going to discuss pros and cons of AI in this profession. So Emma, how can AI enhance diagnostic accuracy in various medical fields?
AI has the potential to significantly enhance diagnostic accuracy across various medical fields, offering tools that assist physicians improve patient outcomes and streamline clinical workflows. So, for example, in radiology, AI is proving invaluable by analyzing X rays, MRIs, CT scans, and ultrasounds to detect patterns or abnormalities that may be missed by human eyes. It can identify early signs of disease like cancer, such as tiny lung nodules indicating early stages of lung cancer. By catching these issues sooner, AI helps doctors and treatment. AI helps doctors start treatment earlier, ultimately improving patient survival rates.
I have also heard that AI is very transformative in oncology or cancer care. AI models help identify biomarkers, enabling oncologists to tailor treatments to a patient-specific cancer type. By analyzing genetic information and tumor characteristics, AI supports the growing field of personalized medicine, leading to better treatment outcomes and fewer side effects.
That is true, honestly. AI has a huge impact on oncology. So many people do not have to go through serious oncology treatments, which is very good. So, to summarize, across all fields, AI can reduce the likelihood of diagnostic errors, improve efficiency, and offer continuous support by providing second opinions from mentioned AI. Many systems learn from vast amounts of data and patient records, which makes them continually improve in accuracy over time. This learning capability enables them to keep up with the latest medical insights and treatment guidelines, assisting physicians in making evidence-based decisions and claims.
Thank you, Emma, for sincerely answering this question, which is very relevant in today's society. In addition, I have another very important question I would like you to address. How reliable are AI systems and what are the risks of malfunction or errors?
So, AI systems are becoming more and more reliable in medical diagnosis, imaging, and predictive analytics, yet they come with notable limitations and risks. A major concern is the potential for false positives or negatives. A false positive where the AI misidentifies a benign condition as serious and which can lead to unnecessary tests, patient stress, or even invasive procedures, which would be chemotherapy for oncology, which is very damaging to patients. So conversely, a false negative where a serious condition goes undetected can delay treatment and worsen patient outcomes. The risk is especially critical in cases like cancer, as I mentioned, where early and accurate decision can be life-saving and is crucial for a patient.
Furthermore, another risk is the over-reliance on AI by medical professionals. If clinicians become too dependent on AI recommendations without sufficient examination, they might overlook important diagnostic details or make decisions without fully considering other clinical evidence. This bias can lead to errors, particularly in complex cases where a more evaluation is required.
That is true. AI can be clinicians can be too dependent on AI, which is not okay. And I totally agree with your opinion and knowledge. However, I have an interesting question to ask you relating to this topic.
Yeah.
Would you trust a hospital that is fully monitored and diagnosed by AI?
That is an unexpected question. Well, I have never actually thought about that, but now I come to the conclusion that I personally would not feel as cared for as in a regular hospital.
Oh, really?
Yeah. I still have some doubts about AI's abilities, and I feel like it could always be improved. Even though humans are not perfect, I still feel like they are the only providers that could be trusted. I have a lot of concerns about my data privacy. AI requires large amounts of patient data, and which may not always be fully protected.
I totally understand your perspective. In fact, a lot of people are concerned about AI data privacy and its protection. Thank you for mentioning AI data privacy. I wanted to talk about it a little. So patient data must be handled with protection laws such as HIPAA, which is the Hippocratic Oath, which all doctors must take in order to become a doctor. However, breaches of this data could expose sensitive information that is very private to each patient.
Thank you, Emma, so much for coming to my podcast and answering these questions that concern a lot of people who might not be educated in these topics, because AI actually has a big impact in our today's lives.
That is true. AI is basically becoming just very important in our lives, and we must know how to work with it, and we must know the pros and cons of AI. And yes,
Thanks for watching. Bye.
bye.